Dr. John Bell is one of 9 physicians at the Crowsnest Medical Clinic, located in Blairmore, a 2.5-hour drive south of Calgary and situated on the western edge of the Rocky Mountains. It's an area rich in beauty and recreational opportunities such as mountain biking, hiking, fishing, and quadding. The newly redone Crowsnest Pass golf course is breathtaking and has become a destination getaway for golfers from across Western Canada. With all that going for it, perhaps it's no surprise that Dr. Bell came to practice here. But if you dig deeper, you'll find he was also drawn by the reassuring support of the entire healthcare team here.
We wouldn't be able to do what we do and care for people with the same quality without the team. There's the physician piece, but the most important piece is the rest of the team. The nurses and the MOAs and the administrative staff who sort through the countless referrals, the front end staff who take the calls. They have remarkable problem-solving abilities.
The Crowsnest Medical Clinic team practices the patient medical home model. Family physicians work in teams with other healthcare professionals to provide accessible, high-quality care for their patients. A social worker connects patients to community resources.
It could be mental health related, it could be financially related, it could be legal matters.
Keep your arms here and you're going to rotate out.
4 times a week, a physiotherapist sees patients at the clinic. Ultrasound is available. In partnership with Alberta Health Services, a mental health therapist comes from Lethbridge once a week.
And we focus primarily on mild to moderate mental health concerns.
The clinic is accessible to all 5,600 residents of the Crowsnest Pass.
Even if you don't have a family doctor in this community, if you live within this community, the staff here make sure that you get an opportunity to see a physician.
The healthcare team certainly goes above and beyond for patient care.
We had a patient that had to come into hospital and his wife was also in hospital and he didn't want to leave his home due to 2 pets he had in the home, and so our nurses actually arranged for his dogs to be fostered by staff from our office.
Doctors and nurses from the clinic regularly see patients at the Peaks to Pines Senior Lodge.
A little sore.
Here, Dr. Vanessa Rogers is spending the afternoon checking in on her patients. She's one of 9 physicians practicing out of the Crowsnest Medical Clinic. A few years ago, 5 physicians left, either retiring or moving away. A devastating blow, but nonetheless, the team pulled through.
A lot of communities in Alberta over the last couple of years suffer through their emergency rooms being closed when they can't be staffed, and that has never happened here in the time I've been here.
Dr. Christy Penner is seeing patients in emergency. Physicians here do shifts in ER and make rounds of their patients in acute care. Some do low-risk obstetrics and/or support surgeons from Lethbridge in the operating room. Today, Sean Bristow, a third-year medical student from the University of Calgary, is alongside Dr. Penner. Sean is here for a year-long clerkship and is staying at no cost at RhPAP supplied accommodations within walking distance of the hospital.
There's a lot of sense of belonging and friendship in addition to the work. Just as an example, already in the first 2 weeks I've been invited on some hikes with some of the nursing staff.
In 2022, the Crowsnest team was chosen the best rural education site by University of Calgary medical students and staff.
It's a really rewarding part of my practice, and that's really the reason that I continue to do it, because it does energize me and it is a great recruitment tactic as well for rural Alberta.
Directly this way.
In the past 2 years, 2 physicians who previously did residencies here have started full-time practice in the Crowsnest. Dr. Sharabati originally came for a 4-month locum here during the start of COVID. She's now the community medical director.
The biggest thing, and that's kind of really why I stayed, is because the team here is extremely collegial. As someone who was a brand new grad who really did not have a lot of rural experience at all, the team really took me under their wing. I knew that I could always call someone at 3 in the morning if I needed it.
When a physician is here and they're in trouble and they have something huge that's come in by ambulance or by private vehicle, they literally just have to pick up the phone and one of their counterparts will be here. That is something that I just find so beautiful because it is very easy in rural Alberta to feel like you're doing it all by yourself, and in this site they don't.
Like any clinic, there are those times when the unexpected happens, like when a patient who was late in her pregnancy came in for a checkup.
And she did end up delivering the baby right in the clinic. So it was a bit of a, can you grab me this? Can you grab me that? I need something for the placenta. So I grabbed under the sink the bowl we used for popcorn on Fridays and we delivered the baby.
We have a great group that works here. We're fun.
Honestly, I just enjoy coming to work every day. It sounds cliche, but I do. I've often told my husband that I would work here if I didn't get paid.
This is a pretty phenomenal place to work. I'm so proud to work with the people that I do, and it's just an outstanding team to work with.
Congratulations to the Crowsnest Medical Clinic, recipients of the 2024 RhPAP Rhapsody Healthcare Heroes Award.